The journal article Emergency Medicine Updates, Spontaneous Bacterial Peritonitis provides important insights and on the diagnosis and management of spontaneous bacterial peritonitis, SBP. SBP is a common infection in patients with cirrhosis and ascites, and it carries a significant risk of mortality. The objective of this paper is to evaluate the current evidence-based updates related to SBP for emergency clinicians. The article discusses that while SBP is typically caused by gram-negative bacteria, there is an increasing occurrence of infections caused by gram-positive bacteria and multidrug-resistant bacteria. The typical presentation of SBP includes abdominal pain, worsening ascites, fever, or altered mental status in patients with known liver disease. However, some patients may be asymptomatic or exhibit only mild symptoms. The recommended diagnostic modality for SBP is paracentesis, which should be performed in patients with ascites and suspected SBP or upper gastrointestinal bleeding, or those admitted for cirrhosis. Ultrasound should be used to optimize the procedure. An ascites absolute neutrophil count, ANC, of greater than or equal to 250 cells/M3 confirms the diagnosis of SBP. It is advised to place acidic fluid in blood culture bottles to improve the culture yield. In cases where rapid diagnosis is required, leukocyte esterase reagent strips can be used if available. Regarding management, routine transfusion is not recommended despite coagulation panel abnormalities in many patients. Traditionally, a third-generation cephalosporin is used, but specific patient populations may require broader spectrum coverage with a carbapenem or piperacillin tazobactam. Additionally, albumin infusion is associated with a reduced risk of renal impairment and mortality. The article concludes that keeping up with the literature updates can enhance the care provided to patients with suspected SBP. It emphasizes the importance of understanding and implementing the latest evidence-based practices in the diagnosis and management of SBP in the emergency medicine setting.